So, firstly, we acknowledge God Almighty. We give God Almighty all the praise. So, we give God praise. So, today we are going to discuss on communication, which we've already been discussing in the physical class. So, but we'll be using an online platform so that every student will have the same pace and can easily revisit. So this is an ND1 lecture, but council students can also maximize the and comprehend the important key facts that can be seen in council exams. Now, and the one, make sure you notify the course reps. You write your wage numbers. Yeah, good evening, everyone. I'm seeing your messages. So make sure you write your wage numbers. Notify the course rep to come online and you write your wage number. So we're going to discuss on communication. We're going to complete this this phase so that we can enter into bed making. Like I said, uh, you don't neglect anything. From now, you are already preparing for the future, your counsel. All right. So now we discussed physically on communication, and we said that communication is the exchange of information. So there is always an exchange, and with every wonderful student in ND1 already understood this class. All right. Like I said, this class will be for both final years and ND1 because you will see the same thing in the exam. All right. Those that are writing their roll number, please make sure that the course rep is live, right, to pick the names of those that are writing their roll numbers. Now, quickly let us dive into the discussion. So, communication according to direction, which we discussed in the class, where we have the upward communication. For the sake of the final year students that are here with us, that are preparing for their council exams, we say that upward communication is the flow of information from a junior staff to a senior staff. So upward, when a junior student, those in ND1, is talking to someone in final year, that is what upward communication. All right, when a junior staff is talking to someone up on a senior staff, is upward communication. Please, for the final year student, this is a refreshing. Are we together? This will help to refresh you. Upward communication is when a junior staff is speaking to a senior staff. That is what upward communication. Don't forget this. Upward, everything going up, just like climbing a staircase. When you want to go to floor 2, you have to climb the staircase from downstairs. All right. So upward, there is an upward movement. So upward communication is the flow of information from a junior staff to a senior staff. Please don't forget this. All right, for the final years, because this class is for both final years. So the advantages for those that are writing: improves decision making, encourage staff participation, help management identify problems. We've already discussed this in the physical class. Now, please stop writing your roll numbers, all right? Before the class ends, I will take the attendance, all right? So we have downward communication. We have downward communication. This is the flow of information from a senior staff to a junior staff. Remember the shortcut I gave for students to remember this upward communication. When someone that wants to go to floor 2, floor 3, we start down from downstairs to climb up. So upward communication is from junior staff, from downstairs, from junior staff to floor 2, which is senior staff. Please don't forget this. Use this to remember it. All right. Why downward communication is coming from that 2 or 3 downwards. So downward communication is the flow of information from a senior staff to a junior staff. Please, do we understand this? Do hope we understand this. And remember, in my class, you don't cram, you do what? You learn. So downward communication is the flow of information from senior staff to junior staff. Like someone coming downstairs. When you are trying to come downstairs, you are coming from above, you are coming from a higher level. So when a year 3 student is talking to a year 1 student, that is downward communication. When a CMD is talking to a nurse, that is what downward communication. But when a nurse or a junior doctor is talking to the CMD, that is what upward communication. Please don't forget this. So number 3, we have the horizontal communication. And horizontal communication is the exchange of information between individuals at the same level of authority within an organization. So horizontal communication is an exchange of information between individuals at the same level of authority. So when a year 1 student is talking to a year 1 student, that is what horizontal communication. When a nurse is talking to a nurse, that is horizontal communication. When a doctor is talking to a doctor, that is horizontal communication. But when a nurse is talking to a HNS, that is what? From junior to senior, that is what? Upward communication. When a HNS is talking to a nurse and just a nurse, is what? Downward communication. But when a HNS is talking with another HNS, that is what? Horizontal communication. There is the same level of authority within that organization. Are we together, wonderful students? Yes, we are. Hope this to this point it is comprehensive because we already discussed on this class physically. Just making a recap. So example, nurse to nurse, doctor, pharmacist to pharmacist. Advantage: it promotes teamwork, it encourages cooperation, it improves patient care. Disadvantage: it may lead to conflict. Yes, because they're at the same level of authority, so there can be conflicts. Whose word will go first? Whose word are they going to obey? So there might be what? Conflict, because it's what? Horizontal communication. So now we have diagonal communication. Diagonal communication is a communication between individuals from different departments and different levels of authority within an organization. So diagonal, from the word diagonal, it is not horizontal. It is not going up, it's not vertical, it is not horizontal. It's what? Diagonal. Just diagonal means like drawing a triangle, a diagonal shape. All right. So diagonal is between individuals from different departments and different levels of authority within an organization. So when a CMD, that is Chief Medical Director, is talking with an HNS, that is diagonal. They are not in the same department. CMD is for the doctors, HNS is for the nurses. They are not in the same department. So that's what? Diagonal communication. So we can't classify it. This is why there is an outrage in the nursing profession, where some will say that doctors are better than nurses, nurses will say that nurses are better than doctors. Now every wonderful student is listening to me from those from different places around Nigeria that is listening to me by God's grace. Learn that what we can't classify it because we can't put it either in upward or downward. Nobody is senior above each other. We can only classify it in a diagonal way. All right, because they are not in the same cadre, they are not in the same class of authority. But if it is for the nursing department, we can classify authorities. So based on diagonal communication is between different levels, different departments, and different levels of authority. So a doctor talking to a nurse, we can classify it whether upward or downward. It is what diagonal communication. Are we together, wonderful students? Are we together? Yes, we are together. I'm impressed with the messages I'm getting. So, examples: nurses communicating with the lab scientist, that is diagonal. Nurse communicating with a pharmacist, diagonal. Nurse communicating with a physiotherapist, diagonal. All right? Now, what we have for today is what we call therapeutic communication. Every wonderful student, make sure you are writing. Make sure you are writing. Therapeutic word communication. Very important. This is for communication. This is the last discussion on communication before we enter another thing. Right? Like I said, tomorrow I'll be invigilating students that are writing their exam, their exams soon to write pre-council, the final year. So I won't be chance to enter your class tomorrow. So let's take note on this for your exam purpose. Therapeutic what? Communication. So, what is therapeutic communication? Therapeutic communication is a purposeful interaction between a nurse and a patient aimed at promoting physical, comma, emotional, comma, and psychological well-being. I come again. Therapeutic communication is a purposeful interaction between a nurse, a patient aimed at promoting physical, emotional, and psychological well-being. So, what is the number one thing that we are getting here? It is what? Purposeful. There is a purpose. It is not just an ordinary communication. Like I taught you in the class that we have types of communication where we have the verbal communication when someone speaks to you with voice audibly. We have the non-verbal, which I told you that dressing is a non-verbal communication. The way you dress tells people who you are. You are communicating with people. I also told you, for those that were not in the last class, I also told you that to touch someone can mean a lot of things. Touch is a non-verbal communication. I also told you that appearance, the way you appear, is a non-verbal communication. Eye contact, non-verbal. Now, but all these things are communication. They are under communication. But what we are trying to discuss today is a subheading called what? Therapeutic communication. There is an addition. It's not just communication now. What we have now is what? Therapeutic what? Communication. Therapeutic. That word therapeutic, it brings healing. There is a purpose within that communication. That is why it's called what? Therapeutic what? Communication. It is not just ordinary communication. It is not just touching someone. It is not just eye contact, but what? Therapeutic what? Communication. Are we together? It is not just, don't forget this I'm saying now. It is not just what? Communication, but what? Therapeutic what? Communication. There is a purpose there. That word therapeutic, there is what? A purpose there. What? A nurse and what? A patient. Now, this is where council students should focus on. Council students, because, and also the year one, year two that are in this class, please focus on this therapeutic communication. You will see it throughout your course of study. You can see it in your final year exams. Therapeutic communication. It is not just ordinary communication, but this communication now is therapeutic. It has the purpose. The purpose is to what? Bring healing, to bring cure. There is a patient there. There is someone that needs it. So everything that is being communicated is all connected to one focus, which is what? Promote physical, emotional, and psychological well-being. There is a promotion of health there. That is why, in fact, in your exams or anywhere, whenever you hear therapeutic communication, any communication that does what promote health is what therapeutic what communication. What are the objectives? Number one is to establish trust with patients, therapeutic communication. Number two is to what? To encourage expression of feelings. Number three is what? Identify patients' needs and problems. When you are communicating with someone, how are you feeling? You are identifying the person's need, the patient's need. The communication there is all geared toward one purpose, to promote what? Well-being. Now, my wonderful students, if I enter your class and I say, what is therapeutic communication? What you are going to tell me is any communication that is focused on what? Promoting well-being. You are correct. So whenever you hear the word therapeutic, like a therapy to bring what? Healing. When you are asking a patient a question, that's therapeutic communication. So many students will be going for their postings. Now, when you are communicating anything you are doing that is geared towards promoting well-being, it is called what? Therapeutic what? Communication. A person, another objective is to what? To reduce anxiety and fear. A patient can be having anxiety and fear. You can come and calm that patient down. That is what? Therapeutic what? Communication. Someone can ask you, sir, what is this for? What is this injection for? And you are providing health education. Can AS marry AS even if they love themselves so much that they cannot live themselves? You see a patient SS and SS and they say that they can't live without each other. And I want you people to have be comfortable in this class. An SS and SS, they say, no, sir, or nurse, they love themselves so much as that they can't live, they cannot marry any other person except themselves. So, as a nurse, what are you going to do? Will you advise them to marry each other? No, because of the future. So, in the process of you bringing any health education is what? Therapeutic what? Communication. You are trying to bring therapy through your words, through your actions. Remember, we discussed on communication through verbally, through non-verbally, through visually, through electronically. So anything that is geared towards what? Promoting health and well-being is what? Therapeutic what? Communication. So another objective is promote patient participation. Make sure you're writing. Improve, I sent you a note today. Improve coping and recovery. Enhance treatment compliance. So what are the characteristics of therapeutic communication? Therapeutics of what? Characteristics of therapeutic communication. Number one, it is patient-centered. You are focusing on the patient. You and the patient is not coming there to discuss. How are you doing? I didn't see you at work last night. All those things are just communication. Therapeutic communication is patient-centered. You are trying to promote well-being. So a nurse that is discussing with another nurse is not therapeutic. A nurse discussing another story with a patient, it is not therapeutic. Anything that is patient-centered to promote well-being is what? Therapeutic communication. So number one, it is what? Patient-centered. Number two, it is purposeful. That is promotion of well-being. Number three, it is professional. You ask question, the patient answer. It is professional. Number four, it is emphatic. You understand? You are showing empathy. All right. The next one, it is respectful. You talk to a patient in a respectful manner, not with someone that is having hypertension. You stay talking a wrong way. None of my students should act that way. So you should what? It should be what? Respectful. Should be confidential. You don't expose a patient. You don't expose, no matter what the patient tells you, you don't expose it. Should be honest. These are Characteristics of what? Therapeutic what? Communication. So now, this is where you should listen very attentively, which is what? Phases of therapeutic nurse-patient relationship. Phases of therapeutic nurse-patient relationship. This, you will see this in your council exam. Please pay rapt attention to this. To all my wonderful students in the private lecture room, make sure you have already subscribed so that you will always get information. Please, very important. Very important. Questions that you can see in your exams. Now, number one is what? Pre-interactive phase or pre-interaction phase. Now, what is this stage? This is the stage before meeting the patient. Write it down. This pre-interaction phase, this is the stage before meeting the patient, where the nurse prepares and reviews available information. Please take note. Phases of therapy. We have the what? The pre-interaction phase. And the pre-interaction phase is the stage before meeting the person. So if you are still in the nurse's room and you are preparing to go and meet a patient, it is what we call what? Pre-interaction phase. You've not met the patient. Please take this place serious. Are we together? You've not met the patient. That is what? Pre-interactive what? Stage. Not you not just meeting the patient, you are doing some certain things. You are reviewing patient record. For like in your exams, you will see questions like this. Pre-interaction phase houses some activities, name them. So how the activities that is being done in the pre-interactive phase is the what? Reviewing of patient record, preparing yourself mentally as a nurse, identifying personal biases. Now, after the pre-interactive phase, we have number two, what? The orientation phase. The orientation phase. Now, what is the orientation phase? This is the first meeting where the nurse and the patient establish trust and define the purpose of interaction. Pre-interactive phase, this is the phase before, that word before the nurse meets the patient. Before. Pre-interaction phase, before. Number two phase is what? Or in my class, you don't cram by the grace of God. You do what? Learn and have knowledge. Don't forget, number one is pre-interactive phase. Number two is orientation phase. Now, what is the orientation phase? This is the first meeting. So in your exams, you can see, the first meeting where the nurse and the patient establish trust. The answer is what? Orientation phase, not post-interactive, not pre-interactive. Orientation phase, the first meeting. So you as a nursing student, when you go for your posting, and for some of my wonderful council students that are listening from different MBAs, when you go to the hospital, because I trust God that all of you will graduate, all right, and you will send your reviews. I'm trusting God for that. Now, when you start working in the hospital, the first time you are meeting a patient is what? Orientation phase. The first meeting a nurse have with a patient is what we call what? Orientation phase, where the nurse and the patient establish trust. How are you, ma? My name is this is that. That is what? Orientation phase. So what are the activities? Now, I told you all wonderful students that you will be asked in your exam, list the activities that are within these phases. Please, that's why I say take. Okay, every student. You introduce yourself. We have the working phase. Now, this is where you work as a nurse to treat the person. This is the working phase. Now, okay. After the activities that is being done there, we have what encourage expression of feelings, provide care and education, assist problem solving. This from the word working phase. You are working to treat the person. Is in this working phase. You are discussing with the person. You are prescribing drugs. Is in this working phase. So we have the word the termination phase. We have the word, next one is the word determination what phase. The stage, this is the stage where the next patient relationship ends after goals is achieved. So when you are done treating the person, the final stage is the word determination phase, where the nurse patient relationship ends after the goals are achieved. Now questions can come like this: which stage ends the nurse-patient relationship? This can come in your council exam. A. Orientation. B. Pre-interactive. C. Termination. D. None of the above. What is the correct answer? If you choose orientation, you are wrong. The stage where the nurse-patient relationship ends. If you choose orientation, you are wrong. If you choose pre-interactive, you are wrong. The right answer is what? Termination phase, where the nurse-patient relationship ends. Now, let me give you some things that you will use to remember this. At first, you desire to come into nursing through your universities or colleges of nursing. That is what? Pre-interactive. I'm trying to simplify it so you never forget it. The pre-interactive, you have not entered nursing already, but you are trying to come for you are trying to get admission. That is what pre-interactive. You are not there already, but you're already planning. You're already gathering yourself, both mentally, psychologically, everything. So for the bringing it to the hospital, pre-interactive stage is the stage before meeting the patient. This word before meeting the patient, very important. You prepare yourself, you review patient record. Let me bring it back to nursing. You are checking whether the midwifery, you are checking if you reach the standard. All those things are what? Pre-interactive. After that is the what? Orientation. They have given you admission, but you've not started class yet. They will give you what? Orientation. Welcome to the university, this, that. So, as a nurse, orientation phase, you give orientation to your patient. How are you doing? For your Osce, you take, what do they call it? You take consent, you seek consent. That's what orientation. You explain procedure to the patient. That is what? Orientation. Now, when you start going to school and classes, it becomes what? Working stage, the working phase. When you start treating the patient, it becomes the what? The working phase. Year one, working phase. Year two, working phase. I'm using this scenario to explain this because in this class, by God's grace, you don't cram, you learn. All right? I want every student that joined this class, number one, to mark the attendance, and number two, to have knowledge. You don't fail the exams. All right. So year one, you are is working phase. Year two, working phase. Year three, four, five, as the case may be. Then, when you are done preparing for your council and you pass council, it is now the termination phase. This is where your relationship with anything, school, ends. So, bringing it to the hospital, termination phase is where the nurse patient relationship does what? End. Are we together, wonderful students? Are we together? I believe this scenario like shortcut will help you never forget it. Number one, how many stages do we have? Phases do we have or stage? Four. Number one, pre-interactive, before meeting the patient, before entering the school. I'm impressed. I'm impressed the reviews I'm getting in this life. I'm impressed. I'm impressed. So we have the pre-interactive. The second is what? Orientation. Use the scenario I gave. Before you enter the school, you prepare yourself. You review their prospectus. You review patient's record. These are what pre-interactive. Next is what orientation. They have given you admission, but you've not started anything. You don't know anywhere. Orientation. So you meet the patient, you don't know the patient's name, you ask for the patient's name, the number, the biodata, the health history. They will teach you all those things. Health history, that's what orientation. All right. After the orientation, we have the what? Working stage, where you now go to classes, year one, year two, final year, you write your exam. Then when you are leaving the school or university or college, it's what the termination phase. When you are done, right? Like I said, termination phase is the stage where the nurse-patient relationship ends after the goals are achieved. Please don't cram this. Are we together, wonderful students? Are we together? I'm impressed with all of you. I'm impressed. If there are some of your course mates that are not here, please tell them to join because I'm taking attendance. Very important. So termination phase, you review progress, you provide follow-up informations, you prepare patient for discharge. So we have therapeutic communication techniques. Number one is active listening, paying full attention to the patient. Active listening, you listen attentively, you respond. How are you? You are fine. Not how are you? You are asking, what did you say? You can't hear clearly, or you are busy doing other things. So active listening is one of the key technique to therapeutic communication. Write it down. Active listening, therapeutic communication. Number one is what? Active listening. Number two, that is, and I told you one of the way to listen to someone actively is to maintain eye contact, right? Number two is silence. Not when a person is talking, a patient is talking, you are talking. Remember, therapeutic is a purposeful communication. When a patient is talking, you keep silent, all right? Even if the person is shouting, as a nurse, you keep what? Quiet. Not that you don't know your right or no, but because some persons can be having so many emotional turbulence. So sometimes you keep what? Quiet. I'm impressed with these students. This student, Miracle Favor, who said she's noting everything down. Please, Miracle Favor, take attendance for me. Write the attendance. Take the attendance for me, all right? Next is what? Okay, importance. Okay, next is what? Open-ended questions. These are techniques for therapeutic communication. Open-ended questions. How do you feel? Not will you come tomorrow? Yes, that is close-ended. So you ask a patient what? Either open-ended questions or closed-ended questions. So whenever you see the word open-ended, it means questions that does not just end with yes or no. Open-ended, it is open. It does not end with just yes or no. So examples of questions like that, you ask these questions when you want to take what? Informations in a detailed way. So open-ended, how do you feel about your condition? It is not a question of yes or no. This is where the patient will start telling you a lot of things. Are we together? So don't forget open-ended question. These are techniques for therapeutic what? Communication. Next one is what? Close-ended question. Do you have pain here? The person can say yes or no. Close-ended what? Question. So you can use open-ended question. These are techniques you can use. So clarification is another technique. Asking more information. The person says he or she has pain. You explain. You ask the person to explain. Is it a radiating pain? Is it you ask questions. For how long has this pain been? You ask what? Questions for more clarification. All right? Next is what? Reflection. Returning the patient's feeling or thoughts to encourage discussion. Example, when the patient says he or she is afraid. So Someone is saying that I should. Okay, someone is asking a question that he or she didn't get the open-ended question. Now, whenever you hear of the word open-ended question, we have two questions. Number one is the open-ended. Open end, that the ends are open. How do I explain this now? Open-ended questions. The end there, it is endless. Open-ended. There is no end there. It is open. All right? And we have close-ended. The end is closed. I'm trying to use this to explain. Now, an example of open-ended question. How are you? It's open. How do you feel? How do you feel not being in the class and missing attendance? And not, you understand? It is open. The person will begin to express his or herself. The open-ended has to do with someone, the person you are asking, while responding, the person is expressing his or herself totally. That is what open-ended question. But close-ended is questions like this: are we together? People will say, yes, sir. That is close-ended. The discussion ends there. But open-ended is that the question is open. You can ask questions, you can say your mind, your opinions fully. So you can ask a person, when did this thing start? These things you are feeling, when did this start? You understand? The person can say a lot of things. It started when he or she was 6 years old, up to 18 years, up to 32 years. That is what open-ended. But if you ask a patient, hope you took your medicine, it's close-ended, yes or no. Are we together? So now all these ones are not, it's because of time. So I've sent the note to you. We have the giving information, we have summarizing. You will not just talk everything. You summarize whatever important points and tell the patient. All right. Now we have non-therapeutic communication. First, we just described the therapeutic communication. Now we have the non-therapeutic word communication. The non-therapeutic communication. Non-therapeutic communication refers to a communication method that interfere with effective nurse-patient relationship interaction. Write it down. Non-therapeutic, no, there is no therapy there. The word therapeutic means therapy. Anything that brings care, healing. So non-therapeutic refers to communication method that interferes with effective nurse-patient interaction. Are we together? So we have types. We have things like number one type is what? False assurance. False assurance is a what? A non-therapeutic communication. Now, if anybody tells you you are not reading and someone is telling you you will pass your exams, that is what? False assurance. It is not therapeutic. It is not helping you in any way. Remember, therapy means helping a patient. So we have types of non-therapeutic communication. And remember, non-therapeutic communication are communication method that interferes with the effective interaction between a nurse and a patient. False assurance, you assuring a patient, if you don't take this medicine, you will still be okay. That is false assurance. It is non-therapeutic. It is not helping the patient. Now, whenever you have non-therapeutic, just know that any communication that is not helping the patient, what did I say? Any communication that is not helping the patient is what? Non-therapeutic. Are we together? So false assurance is not helping a patient. You are not reading and you want to score A's. It's false assurance. Anyone telling you will score A's, that this will happen, is false assurance. It's not therapeutic to you as a student. So you don't give, remember we're studying foundation of nursing, you don't give false assurance to what? To patients. Let's be faster. Personal opinions. Giving your own personal opinion. A patient is saying no. This is how he or she understands it. You are not giving the medical opinion, you are giving your own personal opinion. It is non-therapeutic. Are we together? Changing the subject. A person is talking, you are saying something else. It is what? Non-therapeutic. Judgmental responses. A patient is telling you, this is what happened. You are criticizing and blaming the person. It is non-therapeutic. Please, all wonderful students in my class, this is Foundation of Nursing. Please, I hope you are learning what you are going to practice in the hospital tomorrow, because that is why we are having this class. Like I always tell my wonderful students, I am not just lecturing you to know, but also for you to become professional nurses and midwives tomorrow. So you don't give judgmental response to a person. Why didn't you take your drug? It is judgmental. Look at them doing this, doing that. Someone comes to you that he or she have this. You say, why are you doing this? It's non-therapeutic. It's not helping the patient in any way. Miracle Favor and the course rep, please start taking the attendance, because I'm about to end the class. Please take the attendance for me. Take the attendance. All those that have been writing, please, everyone, start writing your attendance again. Start writing it up in the live section. Start writing it up in the live section. So Miracle Favor and the course reps, or anyone, especially that Miracle Favor, take the attendance. So criticizing a patient, your family, your elderly parents is wrong. You don't criticize them, you don't blame them. Are we together? Interrupting a patient, all these things are what? Non-therapeutic. And now we discuss on the communication process, which I said we discussed in the class, that communication process is the sequence through which information is created, transmitted, received, understood, and responded to. Number one is what? Created. An information must be created. It is transmitted, it is received, and understood and responded to. So element of communication process, number one is the sender. Council students, take notes. First is this phases of therapeutic communication. Now is this again, communication process, where we have elements. We have the sender. This is the person that initiates the information, the discussion, the communication. All right, we have the encoding. So the sender encodes. The sender someone can wave for you. Waving is greeting. So that's a non-verbal. So encoded greeting, it can be in waving form. So a sender must what? Encode using words. Someone can say hi. That's a sender uses words. He encodes his message in words. Someone can wave for you. The sender encodes these words in what? Gestures by waving. So the sender encodes a message. So this is what's the message? Message is the information, idea, feeling, instruction that is being communicated. And this must pass through a channel, either by writing, like now you are seeing this being projected. This is a what? A channel, all right? A channel. We have the word the receiver. This is the person that what receives the message, and the receiver must decode it. Some of you, wave can mean a lot of things in different countries. So a receiver must have the ability to do what? Decode and give what? Feedback. And I always tell my wonderful students that communication is not complete without what? Feedback. So we have finally barriers to effective communication. Barriers to effective communication. Communication barriers are factors that prevent the accurate exchange, understanding, or interpretation of information between the sender and the receiver. Please, I believe they're taking the attendance. Communication barriers are factors that prevent the accurate exchange, understanding, or interpretation of information between the what? The sender and the receiver. So anything that causes misunderstanding, errors are what? Barriers. Anything that cause errors are what? Barriers. I already taught you people effective communication. So we have types of barrier. We have the physical barrier. Please take note. Number one, when I enter your class tomorrow, it will be questions, probably quiz. So take note. All right? Read this and I'm explaining. Now we have number one, the what? The physical barriers. So what are physical barriers? Physical barriers are environmental factors that interfere. The word physical, they are physical. Example, noise for your exams. Examples of physical barriers, we have the noise. We have poor lighting. We have distance. Someone that is far from me is a lack of privacy. All right? All right, Nurse Bella, help in the attendance too. Nurse Bella, help in the attendance. Now we have physical. Whenever you hear the word physical, all right, physical barriers are environmental factors. Physical, anything that you can touch, feel, are what? Physical barriers. Examples of physical barriers: noise. Don't forget this. Poor lighting, physical barriers, right? So solution: provide a quiet environment. Next is what? Language barrier. Language barrier. So this is a very important fact while working in the hospital. So language barrier. Someone that is speaking a different language, you can't treat the person very well because you can't even get information, the first-hand information, because you can't understand the person can't understand you. So language barrier is what? A barrier that can affect what? Communication. Number one is physical barrier. Okay, someone is asking a question, what do I mean by poor lighting under physical barrier? Now, for example, in a dark or unconducive classroom, for example, and there is poor lighting in the class, you can't see properly even the lecturer on the board. That can be a physical barrier. Poor lighting in the hospital, for example, all these are examples. You can't even see a patient's quadratus femoris or the gluteus maximus. You can't see clearly, even to give someone an IM injection in the labs or anywhere. So poor lighting can be what? Physical barrier. Are we together? Physical, anything that is physical is what? Is physical. Environmental. Anything that affects the environment is what? Physical what? Barrier. So poor language differences, different language can be a barrier. All right? You can So now we have the psychological barriers. From the word, the psyche, it has to do with the mind, the brain, the emotion, the mental condition. So it can what cause someone that is having emotional disturbance will not be communicating well. If a patient talks to him or her, he will shout for the patient because the psychological stability is not what is not stable. So psychological barriers, someone that is in pain or hungry, the person's mental state of mind will be incomplete. Some of you, when you don't eat and you come to the classes, looking at you, I know that you are not following the class. So that is psychological what barrier. That has become a barrier. But I know some people that when they are well fed and they're in class, you see them smiling because there is no psychological or emotional barriers between them. So someone having fear, anger, anxiety, stress, depression, there will be what? Barriers there. Are we together, wonderful students? So what are the solutions? Okay, it's already in your notes. Now we have psychological. Don't make sure you take note of that. And we have the physiological. Now we have anatomy and physiology. Whenever you hear the word anatomy, deals with what? Structure. Physiology deals with what? Function. So someone that is having a physiological barrier, probably the person Okay, the cause rep is there. The person cannot speak well. Someone that is having physiological, the functions of the body is not functioning well. That is the word physiological barrier. Why psychological barrier is psychological, the psyche of the person, like fear. That is what psychological barrier. Why physiological, physio, the functions of the body. The person can't hear. How can you communicate with someone that cannot hear? Someone that cannot see, someone that cannot speak. These are physiological what barriers. Cultural barriers. People can believe in different things. And if you're telling them, do this, they'll tell you, no, this is not their belief. So cultural barriers is part of what? A barrier that can affect what? Communication. Right? Now, semantic barriers. This occurs when words are misunderstood. Right? You see a doctor's writing, you cannot understand. That is what semantic barriers. All right, like I always tell you, you don't use ambiguous words. Now, many of you, when I said the quadratus femoris and the gluteus maximus, many of you did not understand. That is what semantic barrier. Yes, I already sent note to your group. So organizational barrier, these are barriers that, example, poor leadership, inadequate staffing can what affect what communication. We have technological barrier. These are barriers associated with electronical system, the technology. When there is poor technology in the healthcare systems, there will be what barrier. So ways to overcome communication barriers. Number one is use simple and clear language. Number two is listen actively. Number three, encourage questions. Tell the person, do you have any question? Next is provide feedback, not just keep quiet. You keeping quiet does not show professionalism. You ask questions, you be humble, ask questions. Reply to a patient's questions. These are providing feedback, maintaining confidentiality, reducing environmental distraction. So for your exam, when you are being asked, what are the ways to reduce to reduce barriers? Simple thing you need to do is to go and firstly know the barriers. Example, language barrier, you now find the solution. Physiological barrier, you find the solution. All those things are ways you can improve effective communication. So what are the roles of a nurse in communication? The nurse can be a caregiver to provide patients care, both physically and emotionally. The nurse can be an educator to educate a patient on how to take drugs or what to do and what not to do. You advocate for a patient. You advocate for a patient's right. A nurse is an advocate. A nurse is a counselor. A nurse is a collaborator. You work with other healthcare personnel, right? A nurse is a coordinator. You organize things. These are roles of a nurse. Now, and finally, we have the ethical and legal aspect of communication, where we have what? Confidentiality. This is the responsibility of a nurse to protect a patient's information. You don't give out a patient information. Confidentiality, ethical and legal aspect of communication. So while you are communicating as a nurse or a midwife or a nursing student or midwifery student, you maintain what? Confidentiality. Don't go and spread a person's case with another person. You maintain what? Privacy. When you want to, there's a difference between privacy and confidentiality. So you don't share out patient information. All right? Privacy, also the patient's rights, you keep the patient's rights intact. The person have the right to access his or own personal information. That's privacy. Some of you, your WhatsApps are locked with 10 codes. Your that one is privacy. Your gallery locked with 10 codes. Even though your WhatsApp is already locked, some of you still locked some messages, personal messages. That one is privacy. You having rights over certain things. But to you as a nurse, your own side is what? Confidentiality. Even if being exposed to this, don't share it. That's confidentiality. So when privacy also, when you're addressing a person or betting a patient, you maintain privacy. You don't maintain confidentiality for that. Confidentiality deals more with what informations. So you seek informed consent, veracity. Whenever you hear the word veracity, every wonderful student that joined today's lecture, whenever you hear the word veracity, it means truthfulness, being truthful. Veracity, don't forget this. Veracity means what? Truthfulness. Respect for a patient's autonomy. You respect a patient's right. If the person said, don't give, okay, someone is asking that I am fast. Someone is saying I'm fast. That's because we already want to sum up the class so I can attend to other wonderful students. Okay, every wonderful student in this class, I'm going to I already sent a note. And if you still need it, you can chat me up, all right? I've told you all people should send me your messages, send me your names and your class so that it will be saved. Very important. Very important, all right? For in case you have questions, I will know that it is coming from ND1, ND2, or any class, all right? So we'll still have a quick recap on this, but I'm just going to scroll down. Now, the most important thing I want us to understand, this ethical and legal aspect of communication, these are things you should do and you should not do. Number one is confidentiality. You don't expose the patient anyhow. Number two is privacy, informed consent, veracity, being truthful. All right? Now, another thing that we need to know is what? The phases. What are the phases? Because I'm summing up. What are the phases? What are the phases? We have all of you, I want you to write it. We have the what? What are the phases? We have what are the phases? We have the pre-interactive phase, right? We have the pre-interactive phase. What are the phases of communication? We have the pre-interactive. Number two, we have the orientation. Number three, we have the working phase. And number four, we have the what? The termination phase. I believe every wonderful student in this class learned something tonight, right? So God bless you. God bless you. God bless you. Send me your questions, if any. Send me your reviews. How well did you understand this class? Send me your reviews. Hope you understood this class. The pre-interactive, the orientation, the working phase, determination. All right, send me your reviews. How was the class? Hope you, someone said, thank you, sir, I'm impressed. Send all these things to me on WhatsApp. I want to see also students that follow this class. So I'll also take my own attendance also. So send me your reviews on WhatsApp. Hope you learned something in tonight's class. So God bless you. God bless you. God bless you. Have a wonderful